Moving on to phase 3 of the home exercise program, we start pushing things a little bit more with range of motion. As I mentioned in the other videos, the exact time frame does depend on exactly what you had done and your surgeon's protocol for the given procedure, but the time frame we're looking at is typically around 6 weeks after surgery to 10 weeks after surgery. At this point, we really want to be getting your range of motion at least fairly close to normal, but you're not yet to the point where you're ready to do strengthening. The exercises we're going to show you in phase 3 are all things you should be able to do on your own and at home. So with that introduction, I'll let our physical therapist and our patient get started on demonstrating the exercises.
So the pulley exercise is a good exercise to start getting more aggressive range of motion. Pulleys can be purchased pretty inexpensively outside of the clinic. So main thing is that, again, you're allowing that pulley and the non-surgical arm to help bring yourself up, slowly lowering back down, and then go through again. So first direction is straight above your head, nice and gentle. And then the next direction, you can move your elbow out from your side slightly at about a 45-degree angle. Again, using that non-surgical arm and the pulleys to guide your surgical arm up and get a good stretch. You should feel a good stretch in this direction, but not significant pain. The next exercise is a wall slide. You can take a small hand towel from home and roll it up. What you're going to do is use the hand towel and, again, your non-surgical arm to help guide your surgical arm up the wall. You want to do this nice and slowly, stretching into a good stretch, but avoiding significant pain. Hold up at the top for a second, and then slowly lower back down. This exercise is the wall walk. You want to stand so that your hand can gently be placed on the wall, and you're going to slowly use your fingers to walk up the wall until you feel a good stretch in the shoulder. Once you get to the top, you're going to hold for a couple of seconds and then slowly and gently lower back down. Again, you should feel a good stretch with this exercise, but avoiding significant pain at the top. This is the towel internal rotation stretch. So internal rotation is going to be one of the more difficult motions to get back. This exercise might be a little bit more difficult than the others. You're going to start with a towel over your non-surgical shoulder, and you're going to grab the towel behind you with your surgical hand. You're going to slowly use that left or non-surgical shoulder to pull the surgical arm up your back. When you first start this stretch, you may have difficulty even grabbing the towel behind your back. Slowly stretching up until you feel a good stretch, but again, not into significant pain. Another stretch that we can do for internal rotation is the sleeper stretch. With this stretch, you're going to lay on your surgical side. Your arm should be about 90 degrees out from your body, again with a 90-degree bend in the elbow. You want to grab your wrist and hand with the non-surgical side, and you're going to start to slowly push down towards the table. When you first start doing this stretch, you may not be able to push very far. This is one of the more difficult stretches to do. As that shoulder stretches out, you'll get closer down to the table. Big thing to watch out for is that you're not allowing your elbow to straighten as you're stretching. You should keep it bent at 90 degrees. This is the doorway external rotation stretch. You're going to start facing the wall with your surgical hand against the wall and start slowly turning away from your body. You should keep your elbow close into your side as you're doing the stretch. You should feel a gentle stretch across the front of the shoulder. And then slowly walk back in towards the wall. As this stretch starts to get easier, you can bring your arm further up the wall. Again, just slowly walking your body away from the wall.